Welcome back to the Grio with Marc Lamont Hill. Are you getting the best health care possible? Well, the answer to that might depend on a lot of things, and one of those things might be race. Only about 5.7% of physicians in the United States are black. That's according to the Association of American Medical Colleges. That's troubling because it doesn't reflect the communities these doctors are serving in. About 12% of the population is black in the United States. And as we know, the black community is disproportionately impacted by a number of illnesses because of lack of care and lack of access or inadequate resources. And all of this leads to health disparities. Joining me now is Dr. Bio Curry-Winchell. She is an urgent care medical director and family practice medical professional. Doctor, thank you so much for joining us here at the Grio.
Glad to be here.
How can healthcare be racially biased? That's a question that I get all the time, that doctors don't think about race. Medicine and science are racially neutral. The problem ain't the doctor, the problem ain't the hospital, the problem ain't the urgent care facility. Get over yourself. I hear that so often. Help break this down for us.
Well, when you look at it, it's a problem everywhere and it's in so many different areas. So, when we think about just in general how care is given or delivered every day, unfortunately, race is a part of it. And so, when you look at how certain medications are prescribed, how we look at how just in general, Black people are dying at a disproportionately higher rate, as you mentioned, from preventable diseases. Unfortunately, race is playing a role in every part of healthcare every single day, and it's impacting Black lives.
So I'm glad you said that. A lot of what people think about when they do acknowledge race-based disparities in health outcomes, and they think about it at the responsibility side in terms of the patient. We die more because we don't eat as well. We don't exercise. We don't take care of ourselves. We don't listen to the doctor. We go to the emergency room instead of preventative care. They focus on our side of the equation. And I think there's some things to be said about that in terms of systems and structures. But there's also this other piece, right, which is how we get treated, how we get read, how we get engaged by the medical profession.
I agree. When you look at the fact that the color of our skin actually plays a role in what type of care we're given, I like to break it
Mm.
down. So we have to remember that race is a social construct, meaning humans invented it. It's not biological and it's not genetic. And so blaming or associating specific diseases based on the color of someone's skin is wrong. We have to look at what steps are we missing when we talk about delivering care. It should be individual. It should be about listening to the patient and providing the best care possible and not limiting it based on the color of someone's skin.
So, again, people will say, I'm a doctor. I don't hate black people. I don't have any animus at the racial level at all. Uh, how does this stuff play out? Of course, there's always the foaming at the mouth racist that doesn't want to treat black people, but that's probably a very small number of doctors and other medical professionals. It plays out in more subtle ways than that, no?
Absolutely. I would say the majority of my colleagues, we are here to give the best care possible and really help our patients. That's why we went into healthcare. But we also have to look at the historical mistrust that has happened, with Black people and acknowledge that as healthcare workers. We also need to take a step back and think about unconscious bias. And it's important to know that all of us have it. And it's about, how we judge or stereotype people. And that can really impact what type of care you give, even if it's not intentional, even if it's not of malice. And so I think for doctors across the world, really
Can you make
taking
that concrete for
note.
us? Doc, make that concrete for us. So, give me what are some experiences that black people have in medical uh, facilities, hospitals, doctors' appointments, etc., that reflect this kind of implicit bias you're talking about?
So, you hear about where I went into the doctor and I was in pain and I was just not believed, or there was this association
Mm.
that it was a part of a substance use disorder. And I think that's a very important example that we hear often in so many different ways, that my pain was not heard, I was not seen. And so it was an association of something else. And so that's an example that is happening each day
That's a
in
big
our
one.
healthcare system. Yes.
So it's either you're
And it
lying
can
about
cost
your pain so you can get
someone's
drugs,
life.
right? Because it's either you're lying about pain because you want drugs, or you're a black woman. Y'all could take more pain than the average human being, so we don't need to give you. You need a higher pain level reported to get the same drugs as a white person with less pain.
And we have studies that show that this is happening, every day when you look at Black women dying during childbirth. And we have in the
Mm.
US a very robust healthcare system. So, why is this happening? And so, it's about pain. It's about acknowledging when someone's saying something isn't right. I need help, and that not being acknowledged. So, there are several areas that impact what type of care we get just from the way we look.
What should we do about it? I'm thinking particularly about what my audience members can do to empower themselves. I know there's systemic work to be done. I know there's studies to be conducted. All of that stuff I agree with. But people who are watching this show want to know, what can they do? What questions can they ask medical providers? Who should they talk to? What should they do to make sure that they get the best treatment possible?
So, the first thing I always start with is educate and advocate for yourself. If you feel that you are not being heard by the healthcare provider you're seeing, go to somebody else. And also think about what things you can learn about different diagnoses and diseases for you or your family members, because that gives you the armor to be able to question. And that's a huge thing that I share with my patients, I share with people across the world. Ask questions. And if it's something that you don't understand and you're not given an answer, or an answer that you can really feel confident in, ask again or ask somebody else. So, those are the things I really want viewers to think about. You have the right to have the best care possible. So, ask questions, have an advocate, or, educate as much as you can.
Oh, this is so heavy. This stuff is stressful to me, Doc, because black people deserve to get the best treatment possible. We shouldn't have to ask extra questions. We shouldn't have to organize like this. We shouldn't need TV specials to figure out how to get treated like human beings at the doctor, but we absolutely do. Are you optimistic at all that this will change?
I am. And, I want to hit on what you said. It shouldn't have to be like that. And for now, until we get to that change, it's something we can do, although it's something we shouldn't have to. But I am optimistic that we are going to start to see improvement as long as we continue to share and socialize what is happening to us every single day. And that's why, I have a series that I provide free information on different health topics so people know, they can arm themselves with the information and ask those questions. But I am optimistic, but we have to continue to move that needle and share that this isn't right.
Oh my God, we absolutely have to share this information. It's not right. It is changeable. We have the ability to change this in the long term, but in the short term, I want to encourage everybody out there to do what they have to do to advocate for themselves and their loved ones, because your life is on the line every time you go to a medical provider. Not just black people, everybody, but we have the ability to resist the extra challenges and to fight the extra challenges that we have to face. Dr. Bayo, thank you so much for joining us.
Thank you for having me.